This is Debu Tripathy, MD, Editor-in-Chief of Cure magazine. I'm here at the San Antonio Breast Cancer Symposium and reporting on a couple of developments that were presented on the first full day of the meeting, Wednesday. The area of immunology, how the immune system can be harnessed to better protect us from either the development of cancer or the recurrence of cancer, is an area of great interest. Cancer cells are foreign cells, and just like infections, they should be avoided or treated by our own immune system, just like viruses and bacteria are. But the problem is that cancer cells are very similar to our own cells, so they often evade the immune system. As we've discovered more about how the immune system is regulated, we actually have discovered pathways that dampen the immune system to keep it from being overactive, and these can therefore harness it to be more effective against cancer cells. There's a new class of drugs called PD-L1 inhibitors and PD-1 inhibitors that block one of these pathways and have been successful in melanoma. In fact, recently a drug, pembrolizumab, which blocks PD-1, has been approved for melanoma. These drugs are now being tested in breast cancer, and the first results of pembrolizumab in the use of advanced breast cancer that is triple negative, that is, it doesn't make the hormone receptors, estrogen and progesterone receptor or HER2 receptor, was tested in a small study in patients with advanced breast cancer. This was a group of patients who had received extensive prior chemotherapy, and in this study they saw that about a fifth of the patients had a response. So clearly it's not helping everyone, but this is a very difficult to treat cancer, so we're very encouraged by the activity we are seeing. Furthermore, we want to know if there's a group of patients that respond. Maybe it's a group of patients whose tumors or the cells around the tumor make more of the PD-1 protein, and these studies are underway to sort that out a little further. In this study, they only took patients who made at least a small amount of the PD-1 protein, and so larger studies are going to follow with a larger number of patients where we can analyze this in further detail, and there's even plans to do this in early stage breast cancer to help prevent a recurrence. So we look forward to the field of immunology much more and expect to see more progress, although it's not going to be dramatic, one big fell swoop at a time. We're going to make stepwise improvements in this area as we learn more about the immunology pathways as they pertain to breast cancer. Thank you.